Our guest spotlight today is Dr. Robyn Johnson, aka the lovely Dr. J. How you doing, Dr. J? Welcome.
Hello, everybody.
Welcome. All right. Let me reintroduce you to our friend. We're bringing back our friend of the show, Dr. Robyn Johnson, DVM, who we lovingly call Dr. J. She's a graduate from Michigan State University College of Veterinary Medicine. She enjoys emergency medicine, and she's a bit of an adrenaline junkie, even practicing overseas in Thailand to work with cows and horses. These days, you'll find her in the emergency room at Rocky Gorge Animal Hospital in Laurel, Maryland, and spending time with shelter animals. And today, she's going to talk to us about pets, answering all your questions. Thanks for coming back, Dr. J. Appreciate you.
Thank you.
All right, so I'm going to give you a chance to tell more about yourself if you have something else to say, but I got to ask you, please tell us something that we can't Google about you.
Okay, something you can't Google about me would be that I originally was at the crossroads of veterinary medicine and civil engineering. I've considered being a civil engineer.
Wow, civil engineer versus veterinary medicine. What made you switch?
Love the animals.
I figured. I figured that's always a good reason. Always a good reason. All right, so I'm gonna ask the first question, and I'm gonna just go straight to it. I'm gonna go deep. So you've helped me put down one of my dogs. You personally have helped me put down one of my dogs, and it was one of the hardest things I had to do. And I'm sure it's tough for most dog owners to make that decision to either kind of let them live a few more weeks or months, potentially in pain, or do an expensive surgery, might extend their lives a short period, and not work at all, or make that decision to put them to sleep now. Not an easy decision. So I want to know, how do you deal with that with your patients or your owners? And have you ever disagreed with a colleague or owner about putting down an animal? And how, if so, how do you deal with that? And that question comes from Olivia.
So it is a difficult time in an owner and a pet's life when you're faced with that decision, whether it be due to illness, due to finances, or due to something else. I think of it as a tool to end suffering for that patient so that they do not have to be in any more pain or discomfort than they are already in. I think of it as the final gift that we can give to our four-legged friends, that they do not have to go through extended illnesses. Um, and, I think that every owner comes to that point. It's a turmoil time for them. And if they've come to that point and made that decision, then they have made it. And, you know, sometimes there's nothing more that can be said. Sometimes you may, want to, give this pet, another treatment or a little bit more time, but it's not my decision to make.
Yeah.
And so, I have to just, respect the wishes of the owner.
Yeah.
Um,
I know when I left your office that day, that was like the dog. Her name was Ebony, and I had her when she was like a little puppy in my hand, and I remember that day. And I when I left your office, I honestly could not stop crying. I was like in my car, and I was just bawling for a good. I just had to have been a good, almost a good half hour. Like I had to stop, pull over, stop driving. It's tough. It's a tough thing to deal with.
Yeah, I mean, it's a very, very emotional time for owners. It's a very emotional time for us as veterinarians. We know that it is, for a lot of these pets, and these owners, I mean, for me on emergency, I don't necessarily have that relationship with every owner that comes in because they're coming in on an emergency basis. But when I do work on my gen med side, my general medicine practice, then these are owners and pets that I have treated for years. So it is also emotional for us too to say goodbye, because that we've treated this pet for 10, 20 years even.
Yeah. Extremely. See, Jose says extremely emotional for all involved. All right, Robbie, question. Pet question.
Well, I'm going to take this in a lighter direction for my first question. Why does my cat randomly pee on my stuff?
So there can be lots of different reasons for cats to do what we call inappropriate elimination. The first is to rule out a medical reason. Make sure there's not a urinary tract infection going on. Once you rule out the medical reason, then you're stuck with behavioral. And that's a little bit more tricky to deal with because there's a lot of different reasons for behavior. Sometimes they see another cat on the outside of the window and it's an aggression thing. They're like, "Hey, get away from my, house." Sometimes it is like if there is a new stressor in the house, like a new baby, you brought in a new piece of furniture, things like that,
So
that can
smells.
cause
I could see smells.
yeah,
Yeah.
new smells. And then sometimes some cats, just don't have any more F's to give, and they just
Does fixing them, does that help for cats? I know it helps
um,
with dogs,
it
but does it help with cats?
it can well, there's a difference between spraying and inappropriate elimination. So if the cat is spraying because it's intact and it's marking its territory, then yes, neutering will or spaying will fix that. But if it's truly inappropriate elimination, then it may not change that.
Inappropriate elimination. You mean peeing all over
I
Rob's
love
stuff?
that term.
That's appropriate
I love that
elimination. I
term.
know Jose's probably saying that's
Shut
appropriate.
up. It gets Jose's stuff too, so it is. That's it. Now, just that's going to be the catchphrase now. Past inappropriate
Inappropriate
evacuation.
elimination.
Inappropriate. Inappropriate.
Is it eliminating what's in its body or eliminating the things that it's urinating on?
Right. It's eliminating Rob's use of them.
Right.
All right, Mayor Patrick, you have a question.
Yeah, well, so I'd love to hear more about like so this pandemic has been a weird and challenging time for all of us. Can you talk a little bit about what you've seen? How have people? I think people have probably come to depend more on their pets during the pandemic because of the because of being stuck at home and all that. I mean, how have pets reacted to this time? What have you seen? What has changed about being a veterinarian during the during this pandemic?
That's a loaded question. This pandemic has totally affected veterinary medicine across the board in many ways. The first being that, yes, people did go out and get more pets. They, said, "Hey, we're home. We don't want to be home by ourselves. Let's get a friend. We always wanted a dog. Let's get a dog now." So you have one, an increase in the number of pets. Two, that also we were considered essential workers, so we were still
Mm,
going to work.
that's right.
We were still open. And you have so many hours in a day to work.
Yeah.
And so then you have more pets trying to get into the same number of slots. And then in order to become COVID compliant, most hospitals had to change their protocols a little bit and actually kind of decrease the number of slots available, so that they could maintain proper disinfection and all of those things. So you have more pets trying to get into a little bit less time. So, there's been a longer waits, much longer waits to get your general medicine appointments, before, where you could call up and get an appointment in like a day. Now it's going to take 2 to 3 weeks maybe to get that appointment. And in
Wow.
turn, on the emergency side, since people couldn't get into their regular vet, we are seeing much longer wait times, where you're getting really truly up to 5, 6, 7, 8 hour wait times, to get into the emergency room, or even longer depending on the emergency place. So that has been one big thing that's changed. Two, the pets, you know, some of these pets were not so happy that these owners were home.
That's what Mike Winter just said. That Mike Winter just said that in the comments.
Yes, that they, I would say that I have seen an increase, of stress related problems, foreign body ingestions, blocked cats, so cats who can't urinate. And forget inappropriate urination, it can't be at all. Um, and so, a lot of like foreign body ingestions, a lot of, kind of self traumas, like stress related things. They weren't used to having these people home. The flip side of that is now that people are going back to work a little bit, we're seeing the separation anxiety type things. So destructive behaviors. A lot of these pets, particularly the new pets, because you were socially distanced, you weren't outside as much, these pets aren't quite socialized as much as they should have been. So we're seeing a lot of behavior issues. So it's been a very trying time in this world, in our world. It's been unprecedented. Labor shortages. So, people had to, either they were sick and they out, they came down with COVID and they're out. I mean, COVID took out whole hospitals, luckily not ours, but, whole hospitals had to shut down. Um, and then you have, like, because this is a very largely female occupation at the moment. Those of us with children, you had to start to manage, hey, these kids were home and online and yet they had to go to school. And so, a lot of the female veterinarians, had to reduce their hours or change their schedules because they had home duties now.
Wow. There's been a lot of stuff going on. And so it's affected the veterinarians a lot. All right, so there's one question from Flora Vanessa Leal about cats again. She asks, "Why do my cats keep eating random inedible things?"
Like tape,
So
like sticky tape, sticky tape.
I
Like
do find that cats
tinsel.
tend to like plastic. They tend to like plastic things a lot. I don't know. When I had my cats, you had to keep the plastic bags away and the tops to things. Sometimes it is, just they're bored and it's there. Sometimes there is some type of smell on it.
Mm.
So you may not be able to, like, you got to remember our pets can smell way better than we can. So
Yeah.
if it was happened to be next to some food or next to something that smelled yummy, they can still smell that. And then if they're young, just like little kids, they're, exploring their world and everything goes in their mouth, just like little kids. And so, if you have a cat who's doing that, you just really need to be very vigilant on making sure they don't have access and having appropriate toys.
Lizzie, what's your question?
So just to clarify or to piggyback on that, I have a cat. Everyone I think who knows me knows Remy. I get a lot of packages here, and so once I get a box, once I get a package that has any type of packaging tape, tape or whatever, I have to throw it away immediately because for some reason he's obsessed with it. He eats it and then throws it up. Like maybe 2 days, a day or two later. So it's a horrible cycle. It's a horrible cycle. Um, so Remy was sick a couple of weeks ago, maybe a month or so ago. Turns out he had a kidney infection, and so in thinking about at that time whether or not I might have had to put him down, like Neo said, like I was a wreck, like a complete wreck. He had three veterinary visits in about 3.5 weeks to the tune of $1,600. So I'm telling everyone, please get pet insurance because I did get reimbursed 1,100 of that, which made things a lot easier. But since then, he's fine. He's doing very well. He's back to biting me. He's back to knocking things over, licking my face, scratching, eating my hair, all those things. But what he's now developed is he never farted before. He never had any type of
Never?
substance before. And no, no, at least I didn't smell it unless he was doing it when I wasn't here. Now he's farting. And not only that, it smells like skunk. So, Robyn, do you know what that is? Like, is that normal? Should I be concerned?
So I'm assuming that you said he had an infection. So I'm assuming he was on antibiotics. So there may be a
He was,
change
yes.
to his GI tract
Oh,
and
okay.
the
Gotcha.
bacteria that's in his GI tract. So, there is some overgrowth maybe or new bacteria that's in there that wasn't in there before. So you could consider, trying to add like some probiotics. They make a ton of them on the market.
Okay.
And you can try adding a probiotic and kind of getting the good bacteria back in that GI tract. If you said it was skunky smell, like the other question would be, what could it be? Anal glands. And cats have anal glands
Mm.
too. We think of it most dogs, but cats do too. So, the question is there an anal gland issue? Because again, those antibiotics do change. I mean, they not only do they go after the bad bacteria that they're meant to fight, they can also affect the good bacteria, which can give you changes in your normal flora.
Mm, wow.
Yeah, it's if you were to walk into my house when he's having one of his episodes, you would be like, okay, is there a skunk in here or does she smoke really bad weed? Which is neither. No to
So which is it?
both
Which
of
is it?
those. Neither. I don't smoke, and
Your
I
your
certainly
cat's
don't
smoking up
have
when
any
you're out of
skunks
when
in
you're out of the
here.
house.
Bad catnip,
Listen,
all the bad catnip.
All right.
All bad cat.
that's my second question, Robin, because I have a cat who really does not like catnip. It does nothing for him. And it's been that way since I've had him since he was 2.5 months. He's never, taken a liking to catnip. Is that normal for most cats, or because all I hear is get him some good catnip?
So I mean, it's just like just like in people. I mean, some things you have a good receptor to, and you love it, and some
Hmm.
things you don't. So there are cats who are not affected by catnip. I have not yet run across that cat personally. My cats loved it, and someone gave me fresh catnip once, like the whole plant,
Oh.
and boy, I had to put it in the freezer to prevent any damage.
Wow. There's another question
Nice.
online that came on mypetshenanigans.com. What are special considerations to keep in mind for a tripod dog, one hind leg, as they age?
Oh. Oh.
So, you definitely want to keep into mind a couple things. Is that one, you only got three good legs, so you want to definitely protect those at all costs. Using a good glucosamine chondroitin supplement to help put the building blocks of the cushions of your joints. You want to keep those joints healthy. You want to keep the weight down, so there's less to carry on those three good legs. And then making the surfaces as slip free as possible. So rugs are necessary. They even have this little product that you could put on their little paws to like help prevent sliding. So you can even consider that, so that they're not slipping and causing any other accidents.
Another question. How often, this is from Mel Blaine, how often should you brush your dog's teeth? I think I'm
Mm.
obsessive.
In in a perfect world, I tell my owners all the time, in a perfect world, they would get brushed like we do every day.
Every day. Twice a
In
day? Every day, twice a day, or just every day?
at least once a day.
Okay, once.
And in the real world, I'm happy if it happens several times a week.
Hmm.
I would say that, in my house, my dog is really cute. She does not get her teeth brushed as much. She is low on that totem pole because I have to fight the other two and make sure that they always have their teeth brushed. So
Because it is
she's
a
low on the
challenge to sometimes brush certain dogs' teeth.
And
They
it's
don't
something
like
you
it.
have to start. Yeah, you have to start when they're a baby. You got to start when they were young, because if you wait until an older dog, they may not. They're like, "What are you doing? Why are you in my face? Like, get away!" Um, but if you have like a puppy, then you want to start then getting them used to it. They make toothpaste that comes in yummy dog flavors like peanut butter, chicken. They do make it in mint, and I think that's totally for the human because I don't think dogs care about mint. And they also make fish, which maybe was more for the cats, maybe not so much the dogs, but or some dogs like fish. I don't know. So all the pets, dogs and cats, technically should have their teeth brushed. The reality is we don't see it, and so we do see a lot of dental disease, and we do see a lot of
Mm.
toothless old because they will lose those teeth.
All right. Unfortunately, we are out of time, but you did agree to stay on for our after show. So if you guys want to ask more questions, you can join us in the after show and go to TLSfans.com for the after show. But I do want to give you a minute to say any final words or give out any shout outs.
I have to give out, I promise, my Rocky Gorge crew, giving them a shout out.
Awesome.
Um, especially my overnight crew who is so hardworking. It is Veterinary Technician Appreciation Week. So, for all of the technicians I have ever worked with over this very long time of a career, I truly appreciate you. You guys have worked so hard. You continue to work hard. You continue to show grace. And I'm so proud that I am in this field with you. And like to shout out, everybody who's tuned in. Thank you.
All right.
Thank
Thank you
you,
Aw.
Dr.
so
J.
much
Thank
for
you.
joining us. Again, we'll see you in our after show. Thank you, Dr. J, Dr. Robyn Johnson.
All right.